This is Dr. Someshwar from Shieldconnect. I hope everyone doing good. And I welcome you all on to the Menopause series by Dr. Payal Bhargava, a co-founder of Divine Magic Foundation. Before starting the talk, let me take privilege to introduce Dr. Payal Bhargava ma'am, who is a postgraduate diploma in ART from and reproductive medicine from Kiel, Germany. And she did her fellowship in infertility from IMA Hyderabad, and she is a life member of IMA Menopause Society India and PCOS Society India. She is a member of Managing Committee of PCOS Society India and co-founder and director on board XPS Analytics Private Limited, and consultant at Sri Krishna Diagnostic Center and also consultant at Pranada Hospital, Hyderabad. And she is a co-founder for Divine Magic Foundation, a public health and awareness initiative working at grassroots level and digitally through its YouTube channel. Now, without much further ado, let me turn over the time to Dr. Payal Bhargava to take over the session.
Welcome to our 12th episode of Sailing Through Menopause. Today, I'll be talking on very important topic of urinary infection, which is very common in postmenopausal women. So, menopause and urinary tract infections. The content of my presentation will be urine infection and changes at menopause predisposing to infection, classification, the risk factors associated, organisms causing the urine infection, diagnosis, treatment, and prevention of recurrent UTI. Urinary tract infection is the most common type of bacterial infection in women, with incidence of bacteriuria increasing with age. It affects about 40% of women in their lifetime, and approximately 25% of women will have recurrence within the next 6 to 12 months. Recurrence can range from 16 to 36% in premenopausal women to 55% following menopause. Now, as we all know, the age of menopause in India is around 48 years. So, with 95% becoming menopausal between the ages of 45 to 55 years. As we all know, menopause is associated with a decrease in serum estrogen levels. Now, estrogen receptors are expressed both in epithelium of the urethra and the vagina, in the trigone of the bladder, and in the levator ani muscle of the pelvic floor. Now, due to decrease in estrogen, vulval, vaginal, and lower urinary tract epithelium atrophies. The muscles that in this area deteriorate. The bladder wall also thickens and fibrosis occurs. Amount of urine which is left in bladder after you pass the urine it also increased. The pelvic floor muscles become weak. The sensory threshold of distending bladder decreases. That is, the bladder muscle loses its tone. So what we understand by this is, as the woman ages, due to deprivation of estrogen hormone, there are many changes that occur in vulva, vagina, the muscles of the bladder, which lead to urine infection. Now, there's a term coined as genitourinary syndrome. What do we mean by this? This term encompasses all the atrophic symptoms patients may have in the vulvovaginal and bladder urethral areas from loss of estrogen that occurs with menopause. Now, GSM is defined as a collection of symptoms and signs caused by hypoestrogenic changes to the labia majora, minora, clitoris, vestibule, introitus, vagina, urethra, and bladder that occur in menopausal women. So because of this, what happens to the patient is they will complain of dryness in the area. There will always be a burning sensation and irritation. There's lack of lubrication, discomfort or pain, and impaired function during sexual intercourse. The urinary symptoms will be urgency, dysuria, and recurrent urinary tract infections. Now we classify urinary infection in various stages. There's asymptomatic bacteriuria, that is, the patient will not have any complaints, but he or she will have urine infection. There's symptomatic urinary tract infection. There's uncomplicated UTI, complicated UTI, and so on and so forth. Now, what are the risk factors associated with urinary tract infection in menopausal women? Factors thought to drive higher UTI rates in postmenopausal women includes increase in age, pelvic organ prolapse, where your uterus tries to come out of the introitus, diabetes, lack of estrogen, loss of lactobacilli in vaginal flora. Lactobacilli are the good bacteria we have in that area which prevent any infection from occurring. Increased colonization of tissues surrounding urethra by E. coli, immunodeficiency, chronic constipation, vitamin D deficiency, and urogynecological surgeries. So all these factors lead to increased incidence or episode of urine infection. Now, what are the organisms causing UTI? As you can see in this picture, there are a number of organisms that can cause urine infection. It can be bacteria, fungi, or viruses. Why this is important is I'll discuss later in the video. So bacteriuria in elderly women, the cause is there's due to decreased level of estrogen, there's decreased vaginal lactobacilli, and there's increase in vaginal pH, which leads to more growth of bacteria in the area. Now, what do usually patients complain of when they have urine infection? They will have burning while passing urine. Some of the patients may complain of some discharge. They will have pain in abdomen. Sometimes you can see blood in urine. They will have fever, shaking and chills, nausea and vomiting if the urine infection is not treated at proper time and has already infected and reached the kidneys. The investigations that we usually do for urine tract infection are a complete urine examination, urine culture and sensitivity, and according to that, we usually prescribe antibiotics to the patient. Investigations for diabetes and ultrasound scan are also. So the investigations which we do for detecting UTI are urine complete examination, which tells us the number of bacteria in the urine, and urine culture and sensitivity, which tells us which is the organism causing it, and accordingly we need to treat. The investigations for diabetes and ultrasound scan for post-voidal residual urine is required in women with pelvic organ prolapse or patients who have recurrent UTI. Cystoscopy, ultrasound of the kidneys, and intravenous pyelograph and a computed tomograph scan help in detection of structural urogenital abnormalities, acute pyelonephritis, or chronic renal insufficiency. So these special tests are not indicated for all patients. The most important tests are the complete urine examination and urine culture and sensitivity and fasting blood sugar levels to detect diabetes. Now, the treatment used in UTI in menopausal women, the key in treatment is to decrease the UTI burden in women as well as to prevent antimicrobial resistance. So we have antibiotics which are prescribed in urine infection, which must be given only after the urine culture sensitivity report that comes. Now, treatments are used other than antibiotics in menopausal women are vaginal moisturizers. These products are typically additional effective treatment for vaginal dryness or dyspareunia. Estrogen deficiency may be a causing event for UTI in postmenopausal women. especially vaginal, can be given for prevention of UTI. Vaginal estrogen delivered via ring or cream with contemporary dosing schedules helps in prevention of UTI in postmenopausal patients. Oral vitamin D and vaginal vitamin E have been proposed as treatment besides antibiotics for UTI. The non-antibiotic therapies are the cranberry juice, ascorbic acid, and D-mannose, which can help in reduction of recurrent UTI in patients. The newer approach towards treatment are because of the alarming increase in multi-drug resistant uropathogens made alternative strategies. One strategy is the restoration of the normal flora with lactobacilli using probiotics. The lactobacilli are usually present in all the flora of the vagina. Now, using probiotics, which are good bacteria, we can restore it and help prevent recurrent UTI or the urine infections. Another option is the use of a competitive compound that inhibits attachment of bacteria to the uroepithelium. Unfortunately, both methods have been evaluated without conclusive results, although there's some evidence that probiotics and cranberry are useful in preventing UTI. So as stated, probiotics help in deficiency of lactobacillus species in the vaginal epithelium in postmenopausal women, which may lead to recurrent UTI. Use of both oral and intravaginal lactobacilli can increase vaginal colonization of lactobacillus, which are good bacteria. So the take-home message from this presentation is drink plenty of water, avoid using public toilets, keep your bathroom clean, keep your sugar levels in check. In case of urinary symptoms, contact your doctor immediately and avoid self-medication. Thank you so much for your patient hearing.